Hello guys, now let's go to another chapter, the medico-legal investigation of wounds. Okay, so if you have clarifications or questions from the previous chapters, feel free to message me. Okay, medico-legal investigation of wounds. The outline of the medico-legal investigation of physical injuries. Number 1, general investigation of the surroundings, like the place, clothing, stains, hair, and other foreign bodies. Witness, photography, sketching, or accurate description. Okay? So, as an investigator, you will investigate the surrounding circumstance. Okay? Like the dress, okay, and other matters. Second, examinations of the wounded body. Examinations that are applicable to the living and the dead victim, like the age of the wound, the weapons used, reasons for the multiplicity of wounds, determine if accidental, suicidal, or homicidal. Then, let B, examinations that are applicable only to the living, like the injury is dangerous to life, if injury will produce permanent deformity, if wounds produced a shock. Examinations that are applicable to the dead victim only. First, determine if the wound is ante-mortem or post-mortem and mortal or not, caused by accident, suicide, or homicide. Okay? You should take note whether the wound was inflicted before the death of the victim or after. Okay? Then, death is accelerated by a disease or some abnormal developments. Examinations of the wound. Check the character, the location, the depth of the wound, the condition of the surrounding, the extent, the direction of the wound, and number of wounds and condition of the locality. To determine if the wounds were inflicted during life or after death, consider hemorrhage, inflammation, signs of repair, retraction of the edges of the wound. Okay? Examine the wound itself. Okay? Okay. These are the signs of ante-mortem wound. Okay? Before death. Hemorrhage more or less copious and generally arterial. Marks of spouting of blood from the arteries. Deep staining of the edges and cellular tissues. The edges gape owing to the reaction of the skin and muscle fibers. Inflammation and reparative process are still present. Okay? And then, these are signs if the wound was inflicted after death or post-mortem wound. Hemorrhage, slight or none, and always venous. No spouting of blood. Blood is not clotted. The edges and cellular tissues are not deeply stained. The edges do not gape, but are closely approximated to each other. No inflammation or reparative processes. So now, how to determine if the wounds are homicidal, suicidal, or accidental in origin? Okay? So, check as to the nature of the wound inflicted, like abrasions, contusions, incised wounds. Also consider external signs related to the position and attitude of the body. Location of the weapon, the motive underlying the commission of the crime and the like, the personal character of the deceased, signs of struggle, number and direction of wounds, direction of the wound, nature and extent of the wound, and the state of the clothing. Okay? You must check everything in its entirety. Okay? All circumstance must be given notice. approximation of the length of survival of the victim after physical injury. Okay? The degree of healing, changes in the body in relation to the time of death, age of the blood stain, and testimony of the witnesses. Possible instrument used during the commission of the crime. If contusion, probably blunt instruments. Incised wound, sharp-edged instrument was inflicted to the victim. Lacerated wound, blunt instrument. Punctured wound, sharp-pointed instrument. Abrasion, body surface is rubbed on a rough, hard surface. Gunshot wound, the diameter of the wound. Effect of medical and surgical intervention on the death. Offender will still be held responsible for the death of the victim if it can be proven that death was inevitable and that even without operation, death is a normal and a direct consequence of the injuries sustained. Okay? A person committing a felony shall be responsible for whatever will be the outcome of his felonious act. Okay? Felony means crime. Okay? The wound inflicted by him must be the direct and proximate cause of the death of the victim. On the other hand, if the victim merely received minor wounds but death resulted on account of the gross incompetence of the physician, then the offender cannot be held responsible for the death. Okay? You must take note of the attending circumstances. Okay? In order to really know who is liable. Effect of negligence of the injured person on the death. If death occurred from complications arising from a simple injury. A person is not bound to submit himself to medical treatment for the injuries received during the assault. The refusal of the deceased to be operated does not relieve the offender of the criminal liability for his death. Okay? So whatever outcome that may happen by virtue of the assault, then the offender is liable thereby. But if it could be proven that the negligence of the victim is deliberate and that his intention is really the cause of death on himself, then the offender cannot be held responsible for the death, but only for the physical injuries he had inflicted. Okay? So in this situation, it now becomes a matter of evidence. Okay? The offender must prove that the victim was neglectful. Okay? That's why he died. Okay? Otherwise, if the offender will not offer evidence, then he will be liable for the death of the victim. Power of volitional acts of the victim after receiving a fatal injury. A dying declaration may be presented by the prosecutor, mentioning the accused as the assailant. The offender may allege that the physical injuries inflicted by him while the victim was inside his house and that he walked for some distance where he fell, or that the victim after the fatal injury made an attempt to inflict injuries to the accused which justified the latter to give another fatal blow. Okay? Just like what I said before, it is now a matter of evidence. Okay? You must prove that the injury you inflicted as the perpetrator did not cause the death of the victim. Okay? Otherwise, if you will not provide evidence, you will be liable of the crime. Wounds of the big blood vessels like the carotid, jugular, or even the aorta do not prevent a person from exercising voluntary acts. Penetrating wound of the heart is often considered to be instantaneously fatal, but experience shows that the victim may still be capable of locomotion. Okay? The victim can still go to the hospital. Okay? The victim can still seek medical attention. Okay? You must prove that in court. Rupture of the organs is not always followed by death. Extreme caution must be exercised by the physician in expressing his opinion as to the limitation of powers possessed by the injured person to perform acts of volition, locomotion, or speech subsequent to receipt of extensive or fatal injury or wound. Okay? Now, let's go to the extrinsic evidences in wounds. Okay? Wounding weapon, position of the weapon, blood on weapon, hair and other substance on weapon, evidences in the clothing of the victim, evidences derived from the examination of the assailant, evidences derived from the scene of the crime. Okay? You must investigate the situation in its entirety if you are the medico-legal investigator. Okay? Now, let's go to another chapter, physical injuries in the different parts of the body. Head and neck injuries. Injuries in head should be treated with special care and should not be underestimated. Of course, head injuries are dangerous, okay? Absence of external wound doesn't mean that there is no internal injury. Contusions and hematoma is only revealed in post-mortem. The presence of bleeding from the ear, nostrils, and mouth may be associated with basal fracture, okay? Fracture of the vault and other portions of the cranial box may cause unconsciousness, and this may be mistaken for simple intoxication. Okay? So you should always take note. It is preferable to have the patient under careful, intelligent, and continuous observation for at least 12 to 24 hours to avoid risk to the life of the patient. X-ray examinations may be useful in order to determine the presence of fracture. However, it is not uncommon that no fracture is observed, and yet the intracranial injury is quite severe. Okay? Factors influencing the degree and extent of head injuries. As to nature of the wounding agent, degree of injury depends upon the degree of violence, thickness of the scalp, and weight of the weapon. Okay? These minute details should be taken into consideration. Weapons create depressed fracture with laceration of the scalp. Violent contact with the wheel of a motor vehicle causes fissure or comminuted fracture of the cranial box. There is always an associated injury of the brain substance and laceration of the meninges. Now, let's go to the factors influencing the degree and extent of head injuries. Penetrating injuries of the skull, like those caused by a dagger, a nail, or a bullet, may leave a clean-cut opening with the shape and size of the wounding weapon. Okay? A glancing hit of a bullet may cause a gutter-like depressed fracture of the vault of the skull. The intensity of the force. Force is proportional to the degree of damage. Heavy agents may require less force to produce extensive damage to the skull, although the point of impact is wide. Okay? It depends upon the form of the weapon. Okay? Point of impact. There are areas in the cranium wherein if force is applied to them, the injuries are extensive, okay, according to its location. Basal fractures are often caused by transmitted force from one point of impact. Mobility of the skull at the time of the application of force. If the head is mobile, unsupported, and free, it may produce contusion, laceration, or hemorrhage without any fracture on the skull. Okay? Just a matter of reading, guys. If the head is fixed and supported, as when the head is caught by the wheel of a vehicle, jarring movement of the brain is absent, but the fracture is extensive. Okay, it will result to an extensive fracture. There may be complete separation of the nasofacial mass from the rest of the skull. Okay, the skin may be removed due to this injury. Head injuries are classified as to the site of the application of force. Okay, it depends upon the location. Direct or co-injuries. These are injuries which occur at the site of the application of force. So direct injuries may result to in compression of the head by the wheel of a vehicle. When the head strikes an object in motion, as bullets. When the head is in motion and strikes an object, as in vehicular accidents. Indirect injuries. These are injuries in the head which are not found at the site of the application of force. The injury may be at the opposite, or in some areas offering the least resistance, or in areas which have no relation with the site of the contrico injuries. These are injuries which develop opposite the site of the application of force. And then remote injuries. Remote injuries are produced in cases where the force is applied in some areas of the body which have no relation to the head. A fall on the feet or buttocks may cause a basal fracture of the skull. Okay? So even if the head was not hit, it may result to a basal fracture. Okay? Locus minoris resistentia. The injury sustained in the head may not be at or opposite the application of force, but may be found in some areas of the skull offering the least resistance. Okay? It may not be there at the impact point, but those at the areas of the skull where least resistance is present. Contrico injuries, direct and indirect injuries. The injuries may be at the site of impact and at the same time found in some other parts of the head, which may be opposite the site of application of force or elsewhere. Wounds of the scalp. It is serious because it is difficult to prevent the spread of infection. Okay, if there are wounds in your scalp. There is proximity of the scalp to the brain. There is a free vascular connection between the structures inside and outside the cranium. Okay? So, scalp is very important. It protects the brain. Okay? The proximity of the scalp to the brain is somewhat very minute, very little. Okay? So, it is dangerous if you are injured in the scalp. It is frequently difficult to determine the extent of damage of the scalp. Abrasion is commonly unnoticed because of hair. Contusion can be only noticed in autopsy. Hematoma easily develops in the scalp because the cranium is located superficially and the subaponeurotic tissue is loose. The most common lesion of the scalp is a lacerated wound. It is difficult to differentiate laceration and incised wound. Okay? Laceration shows irregular borders and hair bulbs are preserved, while incised wounds involve the cranium. Now let's go to the fractures of the skull. Injury inside the cranial box will always lead to laceration of the blood vessels. Fissure fractures. Fissure or linear fracture radiating crack from the site of the application of force and may involve the base of the cranial fossae. Localized depressed fracture. Localized depressed fracture is sometimes called fracture a la signature. It invariably shows the nature of the instrument that caused the fracture. Okay? So, the object used, okay, will depress, okay, on the skull. That's why it's called fracture a la signature. Okay? If you have questions, feel free to message me, okay? Because our discussions are mostly matters of reading, like definition of terms, okay, enumeration, okay. Our lecture merely assists your study. It is incumbent upon you to read your books, guys, okay, because my lectures are just outline, okay. It doesn't show the entirety of the book. This is just an outline, okay, in order to assist your study. Penetrating injuries of the skull. Sharp-edged instrument produces clean-cut fracture of the skull. The size and shape of the fracture may correspond to the shape of the wounding instrument, okay? Next is comminuted fracture. Comminuted, comminution of the skull may develop as a result of a fissure or a depressed fracture. The presence of comminuted fracture is an indication of the severity of force applied or the use of a heavy weapon. Okay? So, the heavier the weapon, the more dangerous, okay, the more extensive the fracture will be. Pond or indented fracture. In the skull of infants wherein there is a angioelasticity, the production of a pond or indented fracture is common. It may be a result of a simple compression of the skull, as in a ping pong ball. Fissure fracture is likely to develop around the periphery of the dent. And then, gutter fractures. A tangential or glancing approach of a bullet may cause the production of a furrow in the cranium. It may involve both the outer and inner tables. The furrow may cause injury on the blood vessels, causing intracranial hemorrhage or laceration of the brain. Bursting fractures. It is an extensive fracture running parallel to the 2 points of contact. If mechanical force is applied on one side of the head, while it is pressed on the other side against a hard substance, such as a wall, while the individual is standing, or against hard ground or floor, when he is in a lying posture. In such cases, fracture may extend transversely to the base of the skull. The passage of the wheel of a heavy vehicle over the head often causes a complete division of the skull into two parts. The direction of the burst corresponds to that in which the wheel passed over the skull. Okay? So, for example, if you push the person's head to the wall, okay, it can cause bursting fracture. Or if your head was hit by a wheel of a car, then it can cause bursting fractures. Okay, it will burst. Intracranial hemorrhage. Intracranial hemorrhage may occur even in the absence of a fracture, okay? There is bleeding in the head. There is internal bleeding. Hemorrhage may be present without a trauma. The blood vessels of the brain may be diseased and may rupture spontaneously. Extradural or epidural hemorrhage, almost exclusively due to trauma. Okay? This is a reaction to trauma. Extradural hemorrhage is caused by a fracture of the skull. The fracture will cause a laceration of the blood vessel, which are grooved at the inner table of the skull. Vessels involved: the middle meningeal vessels, and laceration, the unilateral vessels. Okay? A person suffering from extradural hemorrhage may complain of headache, vomiting, and drowsiness. Okay? Take note of the signs and symptoms. The pupils may be dilated on the side of the hemorrhage. Examination of the cerebral spinal fluid shows absence of blood, okay? Unless it is complicated with hemorrhage in other regions in the cranial cavity. Subdural hemorrhage. Unlike extradural hemorrhage, subdural bleeding is essentially venous or capillary. It is the most common cause of cerebral compression. There are difficulties in ascertaining the cause and source of such hemorrhage. Aging subdural hematoma or Monroe-Merritt method. In the determination as to how long subdural hematoma existed, the study of the structure of its membranes is made as a basis, or the Monroe-Merritt method. First 24 hours, deposit of fibrin at the margin of the clot with red blood cells and leukocytes are well preserved. 24 to 36 hours, fibroblast found at the junction of the dura mater and the blood clot. 4 days, definite histological evidence of 2 to 3 layers of cell thickness, neomembrane. The red blood cells have begun to lose their sharp contour. 4 to 5 days, increasingly prominent membrane with extension of the fibroblast into the underlying clot. 8 days, the membrane has become 12 to 14 cells in thickness. Pigment-laden phagocytes are found. 11th day, clot broken up into islands by the invasion of strands of fibroblast. 15th day, membrane has formed on the undersurface of the clot and strands of fibroblast. Red blood cells have broken up. The outer layer of the neomembrane is 1/3 to 1/2 the thickness of the overlaying dura. Next, the 26th day, neomembrane is about the thickness of the overlying dura. Blood has liquefied. Red blood cells not clearly apparent. 1 to 3 months, progressive decrease in the number of nuclei of the fibroblast and progressive hyalinization of the membrane. Large blood spaces, sinusoidal vessels filled with red blood cells have become increasingly prominent in the new formed connective tissue. 6 to 12 months, neomembrane has become thick and fibrous. Blood has disappeared, leaving only a few scattered pigment-laden phagocytes. 1 to 2 years, the new formed membrane is distinguishable from the overlying dura only by the parallel arrangements of the connective tissue fibers, which have become more or less completely hyalinized. Okay? These are just matter of reading, guys. Please refer to your book. Intracranial hemorrhage. subarachnoidal hemorrhage. Okay? It means subarachnoidal hemorrhage may be due to trauma or to spontaneous rupture of blood vessels. Its causes may be summarized as follows. First, it may be produced by severe head injury, especially in contrico kind. Second, it may be due to ruptured cerebral aneurysm and is commonly seen at the base of the brain. Third, it may be an extension of the spontaneous hemorrhage of the brain which extends to the subarachnoid space. Fourth, in asphyxia, there may be subarachnoidal hemorrhage in the form of petechial hemorrhage. Cerebral hemorrhage. Cerebral hemorrhage may be traumatic or spontaneous in origin. If a person develops rupture of a blood vessel and suddenly collapses and falls on the ground, producing a certain degree of head injury, it is quite difficult to ascertain the exact origin of the hemorrhage. Traumatic cerebral hemorrhage is usually due to laceration or contusion of the brain in contrico injuries. Okay? Distinction between cerebral apoplexy and post-traumatic intracerebral hemorrhage. In a traumatic intracerebral hemorrhage, the interval between the injury and onset of stroke, which is the symptoms, is usually a week or less. Okay? In a traumatic intracerebral hemorrhage, the injury to the head must be sustained when the head is in motion, and the hemorrhage is the result of the contrico mechanism. Okay? The location of traumatic intracerebral hemorrhage is in the central white matter of the frontal or temporo-occipital region. The cerebral apoplexy is usually at the basal ganglia, a very uncommon site of traumatic intracerebral hemorrhage. History of hypertension prior to the stroke and evidence of degenerative disease are present in cerebral apoplexy. There is a history of head trauma in traumatic intracerebral hemorrhage. Okay? Brain. Laceration of the brain. Lacerations of the brain may be direct or co-laceration or contrico-laceration or indirect. Brain laceration may lead to granulation, tissue formation, and ultimately to fibrosis or the death of a cell in the absence of infection. Histopathological changes following contusion and laceration of the cerebral cortex. Within 3 hours, minimal alteration of the cellular elements at the margin of the wound. Microglia may show slight swelling of the cytoplasm of the dendrites. There is fracturing of the myelin sheath. Cortical nerve cells may show pycnotic changes. 6 to 12 hours, pycnotic cells become more apparent and blood pigment is found between cortical neurons. Glial cells look swollen, especially oligodendroglia in the white matter and perineuronal satellite cells in the gray matter as cerebral edema begins to develop. Okay? The head now becomes edematous. Okay? There is retention of water. 12 to 24 hours. Cortical nerve fibers show fairly numerous end bulbs and early degeneration of the interrupted fibers. Microglia continue to show early swelling of their processes. Pycnotic change and pigmentary infiltration of the nerve cells are still present at the margin of the contusion. Loss of nasal substance may be detected in larger nerve cells. Okay? Please refer to your book because these are highly technical matters and just a matter of reading. Okay? The lecture is just a guidance of the important points. 1 to 2 weeks, increase in the number of granular corpuscles in activity of phagocytic action. Astrocytes are plump and the nuclei are very prominent. Cerebral edema is well shown by the spongy appearance of the white matter. Okay, there is positive edema. Okay, nerve cells in the border zone may show fatty degeneration or cytoplasmic vacuolation. Within 1 month, scarring process becomes fairly static. The gliotic astrocyte scar shrinks and appears gray or brownish in color. Blood vessels are thickened. Hyalinized coats owing to increased density of astrocytic and processed attached to them. Edemas of the brain. Localized edema. Localized edema is observed in deep brain lacerations. The edematous area is soft, swollen, gelatinous, and yellowish-red in appearance. It is observed in abscess and neoplasm. Generalized edema, okay? This is usually associated with severe trauma of the head. Edema of the brain of the generalized type may also be observed in a prolonged convulsive seizure. A sudden death due to tetanus antitoxin, an encephalitis, and in an excessive hydration. Now, let's go to concussion of the brain. Concussion of the brain is a transitory period of unconsciousness resulting from a blow on the head, unrelated to any injury to the brain which is apparent to the unaided eye. The cause of cerebral concussion is still undetermined. The symptoms of concussion vary upon the degree of injury. In a severe injury, the patient may fall down and becomes unconscious. There is flaccidity of the muscles and sphincters are relaxed. So, if this happens when sphincter relax, the victim may urinate, The face is pale. Pupils are dilated and insensible. Skin is cold and clammy. The pulse is rapid. The respiration is slow, irregular, and sighing, and the temperature is subnormal. Okay? Should take note of all the signs and symptoms if the patient has severe head injury. In cases of recovery, there is usually a retrograde amnesia of the accident and even events before and after it. The patient may also develop automatism and may perform criminal acts which may be mistaken to be volitional or voluntary. Okay? When you say automatism, it's just the victim performs things, instinctually. And maybe at the eyes of the law, this is a, intentional. However, it is a disorder, okay? The person is not acting in his or her volition, okay? The person is not lucid, okay? Sometimes his criminal liability can be, he can be exonerated, okay, due to circumstances like justifying circumstance, exempting circumstance, and so on and so forth, okay? Next, compression of the brain. Natural diseases like new growth, abscess, and hydrocephalus may also cause compression of the brain in traumatic compression. The symptoms do not appear immediately after the injury. Post-traumatic automatism. A person while under the state of post-traumatic automatism may commit a crime while in an unconscious state. Okay? Just like what I said before, the person is not lucid. Okay? Post-traumatic irritability. The victim of a head injury may suffer post-traumatic irritability and may lead to do acts of impulsive violence. This is due to brain injury, okay? Not based on the volition of the person. Now, let's go to the face, okay? Generally, wounds on the face heal relatively faster as compared with wounds of the other parts of the body on account of its great vascularity. Most often, injuries on the face are serious because they produce ugly scars or other forms of deformity. Wounds on the face may be due to a blow, vehicular accident, kick, sharp instrument, gunshot, or a blunt weapon. Fractures of the facial bones, especially of the nasal bone and mandible, are quite frequent. The eye. Contusion of the soft tissue about the eyes is subconjunctival. Hemorrhage is frequently observed in a fist blow. Okay? Sometimes during fist blow, it could lead to a black eye. Okay? The injury in the eye. The eye may be lacerated by a blunt weapon or by a piece of stone. Acute inflammatory changes usually occur when injury of the cornea, iris, and lens and may require total enucleation of the eyeball. Penetrating wounds due to sharp instrument or bullets may cause meningitis or total blindness. Okay? The nose. Fracture of the nasal bone is a common sequelae of fist blows and may cause severe epistaxis and facial deformity. Okay? The nose may be bitten in a quarrel, cut with a sharp-edged instrument, and contused, abraded, or lacerated by a blow. Injuries of the nose are usually dangerous to life on account of the extension of infection to the brain. These are just matters of reading, guys. The ear. A blow on the ear may produce a rupture of the tympanic membrane, okay, leading to permanent or temporary deafness. Hemorrhage coming from the ear may suggest fracture of the base of the middle cranial fossa. In a quarrel, the pinna of the ear may be cut off or markedly lacerated or contused by a strong blow. Okay? Do you remember the fight between Mike Tyson and Evander Holyfield? Mike Tyson beat the ear of Holyfield. The trauma in the ear may cause septic infection and may extend to the brain and causes death. The mouth. Contusion, laceration, and swelling of the lips are usually observed in a fist blow, kick, or bite. It may or may not be associated with fracture of the teeth or injury of the gum. Direct violence, occasionally gunshot wound infections following injury of the mouth, may extend to the upper respiratory system and cause edema or gangrene of the glottis. Okay? Any injury to the mouth can affect the respiration because of the connection of the airway passage, which is very near. The neck. Abrasions of the neck may be present in cases of manual strangulation, okay? By use of hand, you strangulate in order to asphyxiate a person. Ligature marks are present in death by hanging or strangulation by ligature. Okay? Incised wounds may be homicidal or suicidal. Suicidal cutthroat wounds are usually diagonal, while homicidal wounds are usually horizontal. Okay? Depends upon the direction. Incised and stab wounds of the neck may involve the trachea and the big blood vessels and nerves, and in most cases, end fatally. Asphyxia, pneumonia, hemorrhage, and shock are the common causes of death from neck injuries. Vertebral column and spinal cord. Fracture of the vertebrae. Fracture of the vertebrae is dangerous to life because of the involvement of the spinal cord. Okay? Injury of the cord due to fracture of the upper four cervical vertebrae causes paralysis of the phrenic nerve, while those due to fractures of the fifth cervical vertebra to the first dorsal vertebrae may cause paralysis of all the extremities. Injuries of the cord at other levels may not cause immediate death, but complications like hypostatic pneumonia, bed sores, and other secondary infection may set in and cause death. Okay? The after effect of such paralysis, okay, can cause death. The causes of the fracture of the spine may be direct violence. The fracture of the spine may be due to a blow by a heavy instrument coming from the back, fall from a height, collision with the motor vehicles, and the hit of a projecting instrument. Indirect violence. Indirect violence may be due to a fall on the feet or buttocks, forcible bending of the body as in wrestling, a blow on the chin or forehead, forcible bending of the head towards the sternum, and slight twist of the body if the person is suffering from Pott's disease. Concussion of the spine. Concussion or jarring of the spinal cord may occur even without any visible signs of external injuries. A physician usually has much difficulty making diagnosis of concussion of the spine. Okay? Just a matter of reading, guys. Please refer to your book. Injuries in the chest. Injuries in the chest are important because vital organs are inside the chest cavities. Okay? Inside the chest, there's the lungs, the heart, okay? Below them, the diaphragm, the stomach, and then the intestines, okay? The liver, okay? And the principal blood vessels. Injuries to the chest wall. The chest wall is easily contused by the application of moderate force on account of the superficial location of the ribs. Stab wounds on the chest are quite common on account of its accessibility when both the assailant and the victim are in a standing position. Okay? It is very common, the stab in the chest. Okay? The intercostal vessels may be involved, causing considerable hemorrhage. Stab wounds of the chest, as a general rule, involves the lungs, the heart, and the big blood vessels in the chest cavity. Bullet wounds of the chest may be superficial or may involve the pleural viscera. Hemorrhage, collapse of the lungs due to the removal of the negative intrathoracic pressure, and pneumonia may develop if the victim does not die immediately. Fracture of the ribs causes severe pain during each phase of respiration, and if complete, it is associated with laceration of the parietal pleura or of the skin. Okay? These are self-explanatory discussion, guys. Fracture of the ribs may be caused by direct violence, indirect violence, then injuries to the lungs. Okay? hemorrhage in the pleural cavity coming either from the intercostal vessels or from the lung tissue itself may cause compression and collapse of the lungs, and the patient may die of respiratory embarrassment or anemia. Contusion of the lungs may be caused by a blunt instrument with or without fracture of the ribs or by compression of the chest. The lungs may be injured by a sharp-pointed instrument or by a bullet. Injury of the lungs may cause bloody froth coming out of the mouth. Okay? Severe traction exerted at the region of the hilus may tear the lungs at the point of attachment. Death is usually due to severe shock or a rapid hemorrhage, okay, due to bleeding. Application of a severe crushing or grinding force in the chest wall causes extensive fracture of the ribs and may result to contusion and crushing injury to the lungs. The laceration may not be so severe, but later the victim succumbs to lobar pneumonia. Injuries in the chest. Complications of lung injuries like hemorrhage, compression of the lungs, severe pneumothorax, cerebral air embolism, hemoptysis, subcutaneous emphysema, and then injuries to the heart. The heart may fail and causes death due to an existing natural disease, independent of trauma. Okay? If the heart is already weak, then such injury could be detrimental to the person. Coronary insufficiency, myocardial fibrosis, valvular lesion, or tamponade due to rupture of the ventricle are common in lesions. Foreign bodies like bullets, shrapnels, fragments of a shell may be embedded in the myocardium without any cardiac embarrassment. The person may live for a long time and may die of some other causes. Tearing of the heart from its attachment may be due to violent compression of the chest, with the pressure forcing the organ downward and away from the neck. The severe traction may cause the laceration of the aorta. Rupture of the heart is usually produced by a blunt instrument or by a crushing injury due to vehicular accidents. The heart is commonly ruptured at the right side towards the base. Death is due to severe hemorrhage, cardiac tamponade, or shock. Crushing injuries of the heart are due to compression of the chest with the fractured fragments, injuring the heart as a vehicular accidents, violent dynamite blast, or crushing of the chest between hard objects. Wounds of the aorta and pulmonary vessels are rapidly fatal. Rupture of the aorta may be traumatic or spontaneous. Spontaneous rupture may be due to aneurysm, okay? The cause of death is either the profuse hemorrhage or cardiac tamponade. Injuries of the diaphragm. Wounds of the diaphragm due to sharp instrument and bullets are caused by injuries either of the chest or abdomen. Any penetrating wound in the diaphragm may cause a potent rent for diaphragmatic herniation. Rupture of the diaphragm is due to a sudden increase of intra-abdominal pressure, crushing injuries caused by vehicular accidents, or traumatic compression of the chest. Death in diaphragmatic injuries may be due to shock, hemorrhage, intestinal obstruction caused by herniation, or the accompanying injuries. The area in the middle superior half of the abdomen, forming a triangle bounded by the ribs on two sides and a line drawn horizontally through the umbilicus forming its base, is vulnerable to trauma applied from any direction. Okay? That point of the abdomen is the most vulnerable. In this triangle are found several blood vessels changing direction, particularly the celiac trunk, its branches, the hepatic, splenic, and gastric arteries, as well as the accompanying veins, the loop of the duodenum, the ligament of Treitz, and the pancreas are in the retroperitoneal space, and the stomach and transverse colon are in the triangle located in the peritoneal cavity. Compression or blow on the area may cause detachment, laceration, stress, contusion of the organ. Okay? That area is very vulnerable because it's like the highway of all vessels. Spontaneous rupture of the stomach may be observed in cases of gastric ulcer or new growth. A blunt force applied at the upper portion of the abdomen may cause bruising or even rupture. The pyloric end and the greater curvature are the most frequent site of a rupture. Penetrating stab wounds of the stomach are dangerous to life on account of hemorrhage. Okay? If the common cause of death really is bleeding and infection. Infection and injury to the adjacent organs like the liver. Tearing of the stomach is common when the person is run over by a motor vehicle at the region of the abdomen. Intestine. Ulcers at the duodenum may rupture spontaneously. The same is true in cases of tuberculosis, amoebic, cancerous, or typhoid ulcerations. Peritonitis and hemorrhage are the common cause of death. Traumatic rupture may be due to a blow, a kick, a fall, or a vehicular accident. Okay? When force is applied to front portion of the abdominal wall, the intestine may be pressed between the vertebral column and the force applied, producing either partial or complete severance or laceration. Okay? It will cause damage. Its septic contents will scatter in the abdominal cavity and would cause generalized peritonitis. Okay? General infection in the peritoneum. Injuries caused by sharp instrument or by gunshot usually cause multiple lesions in the intestine and may also involve other visceral organs. The intestine may be involved in vehicular accidents and on account of the grinding force of the wheel. Severe hemorrhage, laceration, and herniation in the abdomen wall are usually observed. The mesentery may be contused, lacerated, or crushed, but in most cases, its involvement is secondary to lesion in the intestine. The liver, okay? The liver is one of the most vulnerable organs in the abdominal cavity because of its size, weight, location, friability, and fixed position. Injuries are frequently met in cases of blow, kick, crash, fall, or sometimes in sudden contraction of the abdominal wall. The right lobe is more frequently involved than the left, owing to its size and exposed location. Rupture is usually transversely or anteroposteriorly on account of its extreme vascularity. Okay? The victim usually dies of severe hemorrhage, shock, and very rarely of supervening infection. Sometimes recovery occurs after slight laceration, but occasionally abscess develops. Stab and gunshot wounds of the abdomen may involve the liver. Severe hemorrhage or shock usually causes the death. It may be lacerated by the fractured ends of the lower ribs in crash injuries. The gallbladder may be ruptured as a result of a kick, a blow, or a crash injury. It may be injured by penetrating weapons. Death is due to hemorrhage and the effusion of bile into the peritoneal areas. The spleen. The spleen usually suffers traumatic rupture resulting from the impact of a fall or a blow and from the crushing and grinding effects of wheels of motor vehicles. Although the organ is protected at its upper portion by the ribs and also by the air containing visceral organs, yet on account of its superficiality and fragility, it is usually affected by trauma. Okay? Furthermore, the spleen is a shock absorber, and it is the graveyard of the blood, the red blood cell. That's why it is highly vascularized. Okay? Congestion and disease condition of the spleen, as in malaria, typhoid, Kala-Azar, make it more easily susceptible to slight trauma. Laceration of the spleen is more common at the region of the hilus, and the lesion may be longitudinal or transverse. Lesion on the convex surface is also common, especially when the force is applied to the left flank. On account of the vascular nature of the organ and its proximity to the plexuses of the nerves, the victim usually dies of severe shock or hemorrhage. Penetrating stab wounds of the spleen are common, but most often other visceral organs are also involved. Death is due to hemorrhage because the spleen is highly vascularized, because it is the graveyard of the red blood cell. The kidneys. Traumatic injury of the kidney may be due to a blow at the lumbar region, somewhere at the region of the 12th rib. It may be ruptured at the slightest violence when it is diseased, as in cases of hydronephrosis, pyelonephritis, tuberculosis, abscess, or tumor. The kidney may also be ruptured when the individual is run over by a vehicle or severely crushed from a fall. Injury of the kidney is accompanied by perirenal hematoma, which consists of blood and urine. Death is due to severe hemorrhage, loss of kidney functions, and shock. Abdominal hemorrhage is present only if there is injury to the peritoneum and concomitant to the lesions in the kidney. The adrenals may be contused, crushed, or lacerated by severe violence. The right is more prone to injury of its vulnerable location, crush syndrome. These are secondary kidney changes in crushed injuries. Edema and anuria follow a crush. Pancreas. The pancreas may be injured by a violent blow at the epigastric region. Death may be due to hemorrhage, shock, or insulin insufficiency. If death does not occur immediately, fat necrosis is observed in the abdominal cavity on account of the leakage of the lipolytic enzyme. Spontaneous hemorrhage of the pancreas is frequently observed in the tropics. Its exact cause is still a matter of medical research. Now, let's go to pelvic injuries, okay? The injury in the pelvis, very common in geriatric patients, okay? Due to old age and the bone becomes brittle, okay? Fracture of the pelvic bones, especially of the pubis, is common in vehicular accidents and crash injuries. Separation of the symphysis may be observed without any external sign of injury. The patient may show difficulty of locomotion and to a certain degree damage to the urinary bladder. Okay? Urinary bladder. The bladder may be involved in a blow, a crush, or kick at the hypogastrium, especially when distended with urine. Among parturient women, the bladder may rupture in the course of delivery. It may also be involved in fractures of pubic bones. Spontaneous rupture is rare when it is over-distended due to urethral stricture, enlargement of the prostate, or tumor. Symptoms of rupture of the bladder are pain, tenderness at the lower portion of the abdomen, bloody urine, difficulty in urination, and rigidity of abdominal muscles. Death may be due to shock or superimposed infection. Okay? As I've said, guys, these are just matters of reading. Please refer to your book. Always read your book because these lectures are just the overview of the book. Okay? In-depth discussions are in the book, and if you are confused or if you have questions, don't hesitate to ask or message your professor. Uterus. A non-gravid uterus is rarely involved in pelvic injuries, but a gravid uterus is likely to be ruptured in a blow, kick, or crush injuries. Spontaneous rupture of the uterus is commonly observed among pregnant women due to injudicious use of drugs or abdominal presentation. Partial separation of the placenta may be spontaneous or due to trauma. Death is due to shock, hemorrhage, peritonitis, or septicemia. The vagina. Laceration of the vagina may be due to sexual act or a faulty instrumentation to induce a criminal abortion. Now, let's go to the extremities of the body. Physical injuries on both upper and lower extremities are usually due to direct violence, crushing, or some indirect force. Direct violence will result in a contusion, and when the force applied is severe, it may cause interstitial muscular hemorrhage and fractures of the underlying bone. Direct violence may be due to a fall, a vehicular accident, or a direct application of force, okay? By use of force. Indirect violence, such as twisting or pathological fractures of the bone underneath, causes laceration of the muscles around with marked hemorrhage. A patient may suffer deformity, shortening of the extremity, and shock. Crushing injuries of the limb can result in severe soft tissue trauma and are most commonly caused by vehicular accidents or fall of heavy materials. These are usually accompanied by marked swelling, comminution of the bone, and extravasation of the blood vessels. Contusions and abrasions are frequent lesions of the extremities, okay? Because extremities are easily damaged because it is in constant action, constant use. Lacerated wounds are commonly observed in portions where the bones are superficially located, as in the anterior aspect of the leg. Incised and punctured wounds of the hand are quite common on account of its utility and movability. Crushing injury of the extremities may cause laceration of the blood vessels and nerves. Injury of the intima of the blood vessels causes thrombus formation, okay? And in severe cases, aneurysm may develop. Extravasation of the blood into the muscles causes swelling and pain. Fracture of the bone may be due to a direct violence, an indirect violence, or a muscular action, okay? A combination of these. Injury of the extremities may cause shock, hemorrhage, and infection. The shock is principally due to the injury on the nerve, hemorrhage, and fracture of the bones. Infection may be severe and may require amputation of the extremities. Okay? Now, let's move on to another chapter. Death or physical injuries caused by explosion. By explosion, it means that it is the sudden release of potential energy, producing a localized increase in pressure. Investigation of death or physical injuries that is produced by explosion must be concerned in determining the following. First, what exploded? Okay? Is it a chemical? Okay? Is it a bomb? Then, what caused it to explode? What is the reason of explosion? Third, how it produced the injury. Okay? Was the victim burned? Okay? Was there internal injury upon explosion? How was it initiated? So those are the questions that comes to mind when you are the investigator, okay? Classification of explosion as to the source of energy. Mechanical explosion or from hydraulic. This occurs when the pressure inside a container exceeds its structural strength or integrity. Explosions of air pressure tanks for cleaning or paint spray, water pressure tanks to establish water pressure, and the air pump kerosene burner are examples of mechanical explosions. These explode when the pressure applied are in excess of the strength of the containers. As the container disintegrates, there is a rapid localized increase in pressure, resulting in the characteristic of explosive sound. Electrical explosion. When electricity arcs through air, a phenomenon that occurs when two objects of different electrical potential are brought close to one another. A large amount of heat develops. This heat rapidly expands the air in and around the arc, which produces the popping sound of an arc. Lightning, though it occurs in a much complex form with extremely high temperature, may be an example of an electrical explosion. Okay? Nuclear explosion. The release of a significant amount of energy by fusion or fission, and consequently with a significant increase of destructiveness. Atomic explosion, atomic nuclei can be regarded as stored condensed energy. The uncontrolled release of this energy constitutes atomic explosion. Okay, like atomic bombs. Like what happened in Hiroshima and Nagasaki. Okay? Classification of explosion as to the source of energy. Chemical explosion. Like chemical explosion occurs when a chemical reaction produces heat and gas at a rate faster than the surroundings can dissipate. Okay? At the start of the reaction, the initial heat or gas pressure increases the rate of reaction, which progresses at a faster rate until the explosion results. Now, let's go to types of chemical explosion. Diffuse reactant explosion. This is caused by the mixture of gas and air. If the gas and air are mixed in a correct proportion, product of heat and subsequent pressure is produced. Explosion of diffuse reactants must be initiated by flame, spark, or sometimes heat. Mixture of gases with other materials may cause production of flame. The most common examples of dispersed gas explosion is in the internal combustion engine, okay, like what drives our car. Next is condensed reactant explosion. This chemical explosion occurs when large quantity of heat and gas is produced as a result of rapid chemical reaction in a solid or liquid material. It has a point of origin so that the most severe damage is closest to the source, and the effects diminish as the distance from the center increases. There is no need of atmospheric oxygen, and if oxygen is required in the reaction, it is incorporated into the explosive. Okay? Guys, these are just matters of reading. Okay? Condensed reactant explosives may be classified as: first, low-order explosive or deflagrating explosive. Those which rely on burning and confinement to produce explosions. When the reaction is confined, the build-up of heat and pressure causes the reaction rate to increase rapidly to an explosion. Gunpowder is the best known low-order explosion. When sufficiently heated, the nitrate contents is decomposed to nitrate and oxygen. The oxygen reacts with sulfur and carbon producing sulfur oxide, sulfur dioxide, carbon monoxide, and carbon dioxide in various combinations. Second is the high-order explosive. This is the kind that detonates. Detonation is a chemical process which results in the extremely rapid decomposition of nitrogenous compounds, releasing heat, and gas is its reaction byproduct. It is the shock wave spreading out of the explosion that causes the destructive effect of high explosive. Dynamite is an example of high-order explosive. Stable high-order explosive. This compound will not detonate unless they are subjected to detonation. This includes dynamite, like nitroglycerin made stable by clay absorption. Next is unstable high-order explosive. Easily detonates from heat, flame, spark, or percussion. This includes trinitrobenzene or picric acid, fulminate of mercury, lead, antimony, or bismuth, and nitroglycerin. Okay? These are unstable chemicals. Like, for example, fireworks. Death or physical injuries caused by explosion. The destructive effect varies with kind and amount of explosive used and the location of the victim at the same time of explosion. The explosion is accompanied by blast, flame, and fragment primarily. The nature and extent of the injury suffered by the victim may be: first, if the victim is in contact with the explosive, as when he is manipulating, carrying, or sitting on it at the time of explosion, there is complete disruption or fragmentation of the body. Okay? It will destroy your hand. It will burn your extremities. Pieces of the body may be found several meters away from the site of explosion. Some parts of the body may be found hanging on the electric power line. Bones completely shattered, skin and other soft tissues may be found scattered at a certain distance from the site of explosion. The explosion causes sudden increase of atmospheric pressure, which is immediately followed by a sudden fall. This compression-decompression effect causes displacement, distortion, and bursting effect on body parts, especially in the brain and abdominal visceral organs. Aside from these injuries, there is rapid development of scattered foci or small hemorrhages, mostly in organs which easily change in shape and which are rich in blood supply. Okay? If the victim is not so close to the site of explosion, the body, though badly injured, may remain in one piece. Some parts may be dismembered but may be recovered within a few meters. Certain areas of the body may show severe injury, but the triad of punctuate bruises, abrasions, and lacerations may be found distributed all over the body. Okay? All of these injuries have still the effect of the blast wave with a diminishing intensity. Okay? So, distance plays a role in the damage of the body. The peppering kind of injuries may be observed as the distance from the site of explosion increases. The density and severity becomes less until it disappears. However, one or more metallic fragments traveling with moderate velocity may strike the vital parts of the body and may cause death. Okay? Like flying debris. Okay? Metallic debris which can cause death if you are hit. Even if you are far. Okay? Due to the power of explosion. Other effects of the blast wave. The impact of high pressured wave can knock down the person. Okay? In the respiratory organ, the bronchus may be lacerated or the mucosa of the trachea may develop petechial hemorrhages. This effect is not due to the entry of the high-pressured wave along the trachea and bronchi, but by its passing directly on the body wall. Okay? The shock wave can has deleterious effect to the body. The ear is the organ most vulnerable to the blast. Most persons at the vicinity of the explosion may suffer from slight reddening of the tympanic membrane, which signifies that the cochlea has been damaged. Okay? Burns from the flame or heated gas. The instantaneous or momentary flame of high intensity during explosion may cause singeing of the eyebrow, scalp hair, and eyelashes. Clothing may also be burned. Body surface in contact with the flame or exposed to the heated air may develop burns, the degree of which depends upon the intensity and duration of exposure. Next is asphyxia due to lack of oxygen. Explosion causes consumption of oxygen in the surrounding atmosphere, thereby limiting the amount available for human consumption. Of course, heat and fire, when they combined with oxygen, they explode. Okay? Poisoning by inhalation of carbon monoxide, nitrous or nitric gases, hydrogen sulfide, sulfur dioxide, or hydrocyanic gas. The byproducts of the combustion may be protoplasmic poison or may cause death by interfering with the normal transportation and utilization of air by the tissues of the body. Direct injury by the flying missiles. The injury due to flying missiles is influenced by the proximity of the individual to the site of explosion, velocity of the missiles, manner or approach of the missiles on the body surface involved, and the subsequent complications arising from such injuries. The shrapnel's wound may go much deeper or the foreign body may lodge inside the body. The edges of the missiles may be irregular or smooth so that the lesion on the skin may appear like an incised wound. If lacerated, the surrounding tissues may be contused. Okay, the following explosives may cause shrapnel wound: grenade, rifle or hand, bomb, demolition or incendiary, mines, underground or submarine, exploding missiles, anti-aircraft. Injuries from the falling debris. If the explosion took place in a building, the victim may be injured and buried under the rubble. The victim may suffer from multiple injuries of whatever description or die of traumatic or crash asphyxia. Okay? Refer to your book, guys, because these are matters of reading so that you will not get bored. Okay? Identification of the site explosion and collection of evidences. The site of explosion may be identified by the presence of a crater. The original location of other objects located near the blast may be useful clues in the determination of the site of explosion. Soil and other debris may be collected for laboratory examination. Okay? If you are the investigator, you should utilize scientific approach. The entire area must be systematically searched for traces of detonation mechanism. All blown out materials must be tested for explosive residues. If the investigator arrived at the site immediately after the explosion, he may be able to smell the odor of the gas. One of the simplest way of collecting gas samples for analysis is to take a bottle full of water in the area where odor is the strongest and pour the water out of the container. The surrounding air will immediately replace the water removed from the bottle. Then the bottle must be tightly sealed and sent to the laboratory for examination. Okay? As you empty the bottle, the odor will get inside the bottle. Okay? It will replenish the water. Scraping from the debris and other materials at or near the site of the explosion may be subjected to extensive stereoscopic and microscopic examination. Particles of unconsumed explosive may be recovered. Fragments of the explosive materials and debris recovered may be rinsed with hot water so that water-soluble inorganic substances like nitrates and chlorates may be extracted. Okay? The materials may be rinsed with acetone in as much as most explosives are highly soluble to acetone. The extract is concentrated and analyzed in the laboratory. Atomic bomb explosion. Atomic nuclei can be regarded as storage of highly condensed energy, and that uncontrolled release of this energy constitutes an atomic explosion. The explosion is caused by the fission of about 100 pounds of uranium and liberates energy equal to that of a million tons of TNT. It produces millions of pounds per square inch of gas pressure with heat comparable to the sun and light of more than 30 times as bright as the sun at noon time. After explosion, it produces a luminous ball of fire containing radioactive fission products which increases upward in size and creates shock waves moving sideward in all direction. Okay? Remember the bombing of Hiroshima and Nagasaki, Japan, where the atomic bomb explosion went to the sky? The fireball may have the diameter of 7,200 feet in 10 seconds, and in 1 minute time, it may reach a height of 4 to a half miles. Place of atomic explosion. Aerial explosion. The bomb is made to explode on the air. Ground explosion. Explosion is made when the bomb reaches the ground. Submarine explosion. Explosion takes place underneath the surface of a body of water. Rays emitted by radioactive substances during explosion. These are the rays that is emitted. Alpha rays and beta rays. Alpha rays, composed of positively charged helium having a high linear energy transfer and with a poor penetrating power that can be stopped by a sheet of paper. And then beta rays, composed of positively or negatively charged electrons with a higher penetrating power than the alpha rays, but the ionizing power is much less. The electrons are traveling at a very high velocity and in some cases approaching the speed of light. Gamma rays, composed of short rays with high energy and greater penetrating power, and like neutrons, it extends a significant distance and causes much damage to the human body. Next is neutron rays, uncharged and composed of highly penetrating particles and basic element in nuclei of atoms. Characteristics of nuclear bomb explosion that distinguishes it from conventional high explosive bomb explosion. It is many thousand times as powerful as a highly conventional bomb explosion, and the effects of the blast are very prominent. A large proportion of its energy is emitted as thermal radiation, causing skin burns, and it is capable of starting a fire at a considerable distance. The explosion emits a highly penetrating and harmful radiation, and the substance which remains after the explosion continues to emit radiation over a long period of time. Okay? Just like what happened in Russia. Okay? The Chernobyl, that even until today, it the explosion and the residue still emits radiation. Effects of atomic explosion to the human body. The effects of atomic explosion of the human body are inversely proportional to the distance. Okay? So, the distance plays a vital role in the effect. Okay? Whether it's critical or not. 1 megaton of atomic bomb exploded in air can cause fire up to a 10 miles radius. The pressure front of the blast can be felt 1 mile away in 2 seconds time. The blast wave is of sufficiently long duration, which is accompanied by transient blast winds causing damages to the people and the surrounding structures. Other effects of atomic explosions are the same as that of ordinary chemical bomb explosion, but of a much more severe intensity. Aside from the immediate traumatic effects, the radiation emitted by the radioactive substances can also have an effect which may be local or general. General effects. Massive dose causes generalized arrhythmia, disorientation, followed by coma and death. Lesser dose may cause nausea, vomiting, followed by prostration and rapidly developing and persistent leukemia. Later, symptoms may develop in the form of rise of temperature, ulceration of lymphoid, easy fatigability, oropharyngeal ulceration, and severe leukopenia. Take note of the effects. Okay? Take note of the effects, okay? Because maybe it will come out in the exam. Local effects. Individual cells. It causes retardation of cell division, structural changes in the chromosome and cytoplasm, vacuolization, and with evidence of maturation. There is loss of the supporting mesenchymal cells. In skin, epilation of the hair with follicles remaining intact. Sweat glands lose their function. Erector pili muscles not much affected. The skin becomes edematous and later desquamated and ulcerated. Radiation dermatitis is persistent, usually painful with patchy keratitis and foci of ulceration. Hyperpigmentation or depigmentation may later develop. Blood vessels. There is endothelial necrosis and localized thrombosis. The blood vessels thicken because of hyalinization of the collagen. Some blood vessels are occluded with the loss of muscular layer. The eye, cataract develops. The genital organ. In female, it causes sterility, abortion, or stillbirth. In man, it also causes sterility without loss of sexual potency. Factors responsible for the effects of radiation. Age. Children and old persons are more susceptible to radiation. Dosage. Bigger dose of radiation will cause more damaging effects on the body tissues. Kind of radiation. The biological damage is not always proportional to the energy absorbed, but it depends on the kind of energy emitted. Gamma and neutron radiation are most destructive. Fractional doses. A single dose may be lethal when administered fractionally over a long interval of time. Sensitivity. Muscles and connective tissues are radio-resistant, while actively dividing tissues like blood, forming organs, and intestinal epithelium are quite radio-sensitive. Now, let's go to other sources of radiation. Natural source. Cosmic origin. Radiation from the sun or from the outer space. Terrestrial origin. Chiefly thorium series of granite rocks. Man-made source. Diagnostic X-ray equipment. The filament inside a vacuum tube is heated by a strong electric current so that it will emit electrons. The electron is driven on an anode target, rhenium and molybdenum, which causes development of electromagnetic energy. The wavelength and the ability to penetrate depends on the kilovoltage applied. The higher the voltage, the shorter is the wavelength and the more penetrating are the X-rays. As the X-ray passes the tissues of the body, the degree of absorption depends on the density. The bones absorb more X-ray than the air-containing tissues. Naturally, the film behind receives a differential amount of X-ray. The denser substance like the bone will be represented by a lighter image, while the less denser organs will have a darker image. In a fluoroscope, the X-ray after passing the body goes to a screen, and the differential absorption of X-ray by the body is reflected in the fluoroscopic screen. Clinical nuclear pharmaceutical agents, okay? Man-made, these are man-made sources of radiation. Therapeutic radiation apparatus. Radiation sources used in industry like nuclear power plant. The problem of the use of nuclear power in generating plants is the disposal of radioactive waste, which may be in the form of gases, chiefly emitted from the vape. Okay, that ends our topic. However, we have many topics to discuss next time. And for this topic class, these topics are just matters of reading, so always refer to your book, okay? We are just mostly discussing the definition of terms, the enumeration, okay? So if you have questions, feel free to ask me, message me directly, and if you want some additional lecture or discussion, we can have a live lecture, okay? The purpose of this video is for you to be guided in your readings, okay? So thank you and God bless us all.